I'm a pediatrician. I've been in practice since 1984, and we have 70 employees in the practice. We purchase health insurance for our employees, and 3 years ago we got our notice. Every November we get our notice as far as what the health uh, increase in the premiums will be, and the notice said it was going to be increased by 76%. So our agent actually thought that it was an error. He actually wrote back to the company and said, "You sent 76%. We assume this is an error." And they said, "No, that's actually correct." So we called the company and we met with our HR manager, our practice manager, and myself met with three representatives from the company. And we said, "We don't understand, how could a premium go up 76%?" And one of the representatives said, "Well, you're in a pool of 300,000 other participants." And that was the statement. It was like that solved the problem. And so we said, "So does that mean that all 300,000 premiums went up 76%?" And he said, "That's proprietary information. We're not allowed to share that." So we said, "Well, what do you base these decisions on?" And the insurance representative said, "We use something called predictive modeling, which is that we look at your population or your demographic over the next 5 years, and because you employ mostly middle-aged women, we predict that your costs will go up at this rate." And my HR manager at that point said, "So let me clarify, you are basically discriminating against two federally protected classes, women and the aged." And the representative said, "Well, we really don't look at it that way." At which point we literally had to escort him out of the room. He will not admit that, but we literally had to escort him out of the room because I thought he was going to hit the guy. Now, what they neglected to mention and what we knew was is that one of the women working for me at that time had end-stage colonic cancer. So she was costing the system a lot of money. At no point did they say that she was the cause of the increase. But the decision that we were left with is, should we fire her? I mean, that was a viable option, or should we change policies? And again, we were at the company of last resort. So if we had gone to a company that medically underwrites, we would, I guarantee, have been denied care. So basically, what we had to do was change to a different type of policy that the company offers. And in spite of that, we still had a 38% increase in our insurance cost. Every year, we wait with bated breath in November to see what the increase is going to be. And it's always an interesting surprise.